Good morning, guys. So today I'm going to take you guys through a full day of anesthesiology. Right now I'm just sitting outside the hospital drinking some coffee, ready to get my day started. I woke up around 5:50 this morning. The case starts at about 7 today, so my resident texted me and said be here from anywhere between 6 and 7. So the nice thing about anesthesiology is I don't have to round on patients in the morning. That's why I'm able to get here a lot later. You still have to be up early because the cases start usually pretty early, but it's nowhere near as early as surgery. So right now it's about 6:30. As soon as I get in the hospital, I'm gonna sign in, head to the OR, meet up with my resident, ask if they need any help, maybe setting up. We'll go meet the patient in pre-op, and then as soon as we're done with that, we'll make sure the surgeons are ready, make sure the scrub tech's ready, and then we'll go ahead and pull the patient back into the OR and start the cases for the day. Today's Wednesday, so this is my third to last day to this rotation, and then I'm on pediatrics. Actually, only one case today. We're doing heart surgery. I'm not gonna say exactly which surgery, but it's gonna be a longer case, so I do anticipate being in there all day. So yeah, I'm basically just gonna finish up some coffee, head into the hospital, and get my day started. Alright guys, just got home from the hospital, so I'm done for the day. It's about 1:40 right now. We got lucky, well, sort of lucky in that our lecture was canceled. So for this stuff, we don't really have to make up lecture. So all of our lectures are given by attending, so it's understandable if something comes up and lecture's canceled. But anyways, got to go home early. I was in that one open heart case pretty much all day today, so that took up a lot of my time. It was really cool because I've never seen an open heart case before. Just really interesting seeing all the things that kind of tie in with anesthesia and what you have to be aware of and the physiology of the heart and everything like that. So yeah, anyways, it was a really good day. Even though it was one long case, I still learned a lot. But I'm gonna get home and grab something to eat, and then we'll probably head to the gym in a little bit here. I was just kind of sitting here going through all the footage that I got, and I realized that I didn't really get a whole lot of footage of my day. So I really apologize for that, but a lot of anesthesia is dealing with the patient, and you're in a lot of patient situations, so I can't always record just because there's my patient or other patients in the area. Instead, I'm gonna try and talk you guys through kind of a typical OR day, and what you're thinking about, what the process is. So a typical day is you get there at 6:30, you meet your resident, you show up, you help them set up. So the resident will usually pull the drugs from the Pyxis, and I'll help them pull them up into tubes so that way they can give them quickly. I'll help put on the EKG monitors, the blood pressure cuff, the pulse ox, get the laryngoscope ready, the endotracheal tube ready. Basically get everything to go so as soon as the patient comes in the room, you're ready to start the induction and everything goes smoothly. So after the OR is all set up, we usually go into pre-op, we meet the patient, we do the general pre-op anesthesia questions, basically ask them if they've ever had any issues with anesthesia, ask if they have any liver, kidney, any other chronic diseases, just kind of the general pre-op questions. Once the patient has talked to anesthesia and surgery, the patient's ready to come back in the room. The cool thing about being a med student on anesthesia is you really get to do a lot of stuff. As a med student, you're able to intubate patients, you're able to start IVs, you're able to start art lines. It really just you're able to push meds. So it really depends on how well the resident and the attending know you and how comfortable they feel with you doing all of that stuff. For me, I've probably intubated about 10 people overall during this 10-day rotation. I've also done a couple of LMAs, which are really simple. I pushed meds, so you get a lot of hands-on experience in anesthesia. So anyways, back to kind of the order of how everything goes. Once the patient's in the room, we get them hooked up to our monitors. We monitor their vitals so we know their baseline vitals, and then we'll go ahead and get ready for induction. The drugs that we typically use, we'll give them Versed before they come in the room to kind of decrease their anxiety and make them feel less stressed about the surgery. Then we'll give fentanyl for pain, and we'll give prophylactic lidocaine to kind of blunt any cough reflexes or any dysrhythmias that you could potentially induce them once you intubate them, because as soon as that tube goes through the vocal cords, their heart rate usually jumps up. So We're gonna give lidocaine for that reason, and then after that, we typically give them propofol. Etomidate is another option. It just kind of depends on the patient. So we'll give them propofol to put them to sleep. It does cause a little bit of amnesia. I know when I had surgery, as soon as they pushed that propofol, I went instantly to sleep. I don't remember anything after that. I just remember waking up in the recovery room. So it works really well. After the propofol, we're gonna give them a paralytic agent. For the really controlled cases, we typically gave them rocuronium. But in a traumatic situation where you need to be a little bit quicker, we generally give succinylcholine. That's gonna completely paralyze the patient. That's gonna allow you to lift their head up, open their jaw. It's going to basically paralyze all of their muscles. Once you give that paralytic, you're gonna go ahead and grab your laryngoscope, basically get your view where you need to, see those vocal cords, pass the tube down the vocal cords, and you're in the trachea. So once you're in the trachea, you're gonna hook your tube up to the ventilator. Along with oxygen, we give a little bit of volatile anesthetics. So the most common gas used is sevoflurane, but we can use desflurane and isoflurane as well. We're giving them that gas to keep them asleep because the propofol is going to wear off eventually. A lot of the time, the induction process is very stimulating to the patient, meaning they're gonna become tachycardic, their blood pressure is going to drop because you've been giving them the sevoflurane, which vasodilates them and decreases their blood pressure. So you have to give additional drugs to kind of counteract these things and keep your patient in a happy medium and stable vital signs, because you don't want their heart rate shooting up super high and you don't want their blood pressure dropping down. A couple of drugs that we typically gave were esmolol to decrease their heart rate and phenylephrine to vasoconstrict them and bring that blood pressure back up. It's a little bit of an experiment with the patient, kind of going back and forth, trying to find that happy medium of where the patient is comfortable and their vitals are stable. So that's that's kind of the rush of craziness. Now, once the patient's stable, the surgeon's operating, that's kind of the more relaxed time. A lot of people joke that anesthesiologists basically just sit there and do nothing. They play on their phones, do Sudoku or crossword puzzles. But during that, you're monitoring the vitals. You're really making sure, do you have to push more phenylephrine? Do you have to give more fluid? Do you want to maybe give them some albumin to bring back the fluid into their vessels and increase their blood pressure? There's a lot of physiology that you have to constantly be thinking about, and there's a lot of problem solving, there's a lot of critical thinking involved. And the cool thing about it is, for every patient, you're not going to be just giving the same drugs. For certain patients, you have to avoid certain drugs. Maybe you're operating on a diabetic patient who's getting a nephrectomy. You're going to maybe want to try to avoid beta blockers and figure out a different way to decrease their heart rate. Or you might be operating on a pediatric patient with tetralogy of Fallot, so you're going to maybe want to keep their vitals in a different range that you would a normal healthy pediatric patient. There's a lot of medicine you have to think about, but it's still a very procedural based specialty. A lot of quick patient interactions, but very fulfilling patient interactions. Hopefully, if you guys are pre-med students or an MS1 or 2, this sheds some light on the field, and hopefully you guys consider doing this rotation in the future, because I really enjoyed it, and I think it's something that you should at least experience and understand, because you are going to be taking care of patients who have surgery and who have anesthesia. So yeah, that's that, and now I'm going to go ahead and get ready for a workout.
P, what are you wearing? Shake. Are you a shark?
Alright, so for today, I took sour watermelon legend, and then I took the sour watermelon pump, and then I took regular normal flavored or neutral flavored size, which is the creatine muscle builder. During my workout, I'm gonna take some Sour Patch.
But even though they're all really smart, out of all those guys, I joke.
Can you record me, please?
Huh?
Can you record me? Alright guys, all done with the workout. It's time for a post-workout meal. Getting some ramen. Alright, so this ramen restaurant is super festive for Halloween. Got a Jack-o'-lantern. Ghost. Alright, I got curry ramen with some corn. What'd you get?
Some seaweed. Isn't that?
This is what?
Isn't that seaweed?
Yeah, that's seaweed. What'd you get?
I already took a picture of it.
What'd you get?
I don't
What is
know. Ramen.
No, you got the miso buttercorn ramen.
They do have the.
How is it?
It's good.
Try it. It's warm.
I saw this guy do like a poke challenge.
Is it good?
Yeah.
I was told I gotta make it rain on my eggs, on my ramen. Oh, gotta make it rain. Alright, that's pretty good. Was it good? Alright guys, finishing off my night with 2 scoops of Ghost cereal milk whey. The ramen that we had was really good. Right now it's about 10:30. Tomorrow I have to be at the OR at about 6:30. So I'm gonna start getting ready and head to bed soon. But yeah, I hope you guys enjoyed today's video. Comment down below what you guys want to see next, and I'll see you guys next time.